Hi, my name is Monica from Abs After Baby, and today I'm going to be talking to you about how to get strong, healthy abs after baby with postnatal physical therapist, Dr. Becca.
Hi, I'm Becca, and together we are the mom and physical therapist team at Abs After Baby, a company dedicated to helping busy moms heal their abs and bodies safely and effectively after baby, so they can be strong and confident in their post-baby bodies. We're going to talk about postpartum fitness and how the way you exercise before baby might not be best for your abs after baby. We will talk about why it is important to do the right exercises with the right technique, when to start abdominal healing, and how the wrong exercises can contribute to a mom pooch or worsen abdominal separation, known as diastasis recti. We will demonstrate some of the best exercises for postpartum women to strengthen their core, and teach you how to use the best body mechanics while performing daily activities, even while wearing your Lalabu, Sue's shirt, or support leggings.
We have so much great information to share with you today, and we're so excited to be here. So let's get started. After I had my baby 2 years ago, I suffered from abdominal separation known as diastasis recti. I had such weak abs, I could barely lift myself out of bed, and I had this stubborn mom pooch that wouldn't go away no matter how many crunches I did. But fortunately, Becca developed a science-based program to help moms just like me get their strong abs back after baby. And honestly, I feel stronger now than ever before. Diastasis recti is so common amongst postpartum women. In fact, most moms that have it don't even know that they have it. We're going to talk a lot about diastasis recti, and we're going to teach you how to check for it yourself at home. We designed the Abs After Baby 12-week program to help other moms just like me heal their diastasis recti after baby. Honestly, this program is exactly what I would have wanted right after having a baby because it just gives you the confidence to heal your abs the right way. What I love most about the Abs After Baby 12-week program is that it can be done anytime, anywhere, with little to no equipment. There really is no reason why a busy mom can't find the time for this Abs After Baby program.
I specialize in prenatal and postpartum physical therapy and am super passionate about helping moms after their pregnancy and delivery, all while caring for your new baby and growing family. I wanted to start Abs After Baby because I was frustrated when I saw exercise programs claiming to get the mom pooch gone, all while having women do the wrong exercises with the wrong progression, things that could actually make your abs worse after baby. I kept hearing women who felt defeated with their fitness goals, and I wanted to provide the most current science-based program out there for postpartum health. Monica and I are passionate about helping you, the busy mom, get fit and healthy the right way with the right information. We've developed a community of women to support and not compete at Abs After Baby.
So you may be wondering, what is diastasis recti? How do I know if I have it? And most importantly, what can I do about it? I know I was wondering all these questions myself, so Becca is going to give us the scoop.
Your abs go through a lot during pregnancy. Your uterus goes from the size of a fist to the size of a watermelon. And after pregnancy, 60% of women usually have an abdominal separation called diastasis recti, and most never even know they have it. So, what is diastasis recti? Well, it is an abdominal separation that occurs at the connective tissue called the linea alba in between your rectus abdominis muscles. It usually tears to accommodate for intra-abdominal pressure increases, such as a baby. Some signs of diastasis recti can include that stubborn mom pooch, or tinting or bulging when you get out of bed or do a crunch. It can also be associated with low back pain, urinary incontinence, and decreased body confidence, all things we want to avoid. Check out our website for our blog on support wear and exercise and its role in the healing of diastasis recti. Many women, after having a baby, think they need to do a ton of crunches to get those abs back. But actually, all that crunching and advanced abdominal exercises, beyond what you can actually control, can make the connective tissue between your abdominals worse. This is why we're going to show you some simple exercises and tips to help promote healing and strength after baby.
Okay, so now we're going to talk about the AAB brace using breathing to engage those deepest levels of your abdominal muscles. When we breathe deeply in and out, we're able to access our diaphragm, our pelvic floor, and our abdominal muscles on all different levels. So breathing is really important, especially when you're trying to get back to exercises. So when you breathe, you want to have your, in order to practice it, you can put your hands on your lower rib cage and kind of on your stomach. So when you breathe in deeply, you want more of your ribs to expand and your belly to come up than using your chest. And this is something I have to work on myself. So when you do that exhale, you should feel your belly button kind of come down to your spine and those deep levels of your abdominal muscles engage. And this is really important. We don't want you to be tenting or bulging and pushing up with your abdominal muscles. That means you're stressing your diastasis recti, you're stressing your pelvic floor and all those different muscles, and not using your abdominal muscles to the best of your advantage. So really practice your breathing whenever you're doing your exercises. Okay, so now we're gonna try a bridge. This is a great way to stretch the front of your hips, engage your glute muscles, and use your breathing, engaging your deepest abdominal muscles, pelvic floor, and diaphragm together. So what you're gonna do is take a deep breath in, and then on the exhale, you're going to push through your heels, squeeze your glute muscles, and lift your hips up as high as you can without arching into your back. So inhale, and then exhale as you lift, squeezing those glute muscles, getting a stretch on your hips as you come up and down. Okay, so now we're gonna do what we call a bird dog. So we're gonna try engaging those abdominal muscles while we're in our hands and knees position. Start with reaching your arms up, trying to keep those arms straight, reaching out, engaging your abdominal muscles, not arching into your back. And then, when you feel confident, you can add the opposite arm and leg. Alternating back and forth. Really trying to keep your back from arching, your abdominal muscles engaged, no tenting or bulging, no arching through your back. And this is a great way to engage your lower back muscles, your abdominal muscles, and everything together with your breathing. Now we're gonna do a hip flexor stretch. This is a great way to stretch out those muscles that have gotten really tight from having a baby hanging down. And a lot of women struggle with this tightness. So you wanna have one leg in front of the other, and then in this position, you're gonna kind of tuck your hips under, squeezing that glute muscle that's behind you, and see if you feel a stretch. If you don't feel a stretch, you can lean a little bit into it, but I already feel a stretch here. And you're gonna hold for about 30 to 60 seconds, and then you can switch to the other side. Here, tuck under, abdominals tight, no tenting or bulging, no pushing out, and really feel that stretch on the front of your thigh. You could feel this from your hip bone all the way down to your knee, wherever your body is most tight. Now I'm going to teach you how to check for diastasis recti. Remember that diastasis recti can only be diagnosed by a healthcare professional, so if you feel like this test makes it seem like you have it, then you can seek out their help. You're going to take your hands and your fingers and put them perpendicular to your stomach. Right at your belly button, you're going to push down, and then at the same time, crunch up. And you're gonna feel how far deep your fingers go, how wide, 2 fingers, 3 fingers, 4 fingers, how wide it is. And then you're gonna check below and above using the same technique, all the way up from your sternum, your xiphoid process, down to your pubic bone. So you wanna see how long the diastasis is, how wide it is, and how deep it is.
In addition to strengthening exercises, it's also important to use good body mechanics when performing your daily activities. Sometimes just the things we do around the house can put the most stress on our abs, and we don't even know we're doing it. So for example, when you're getting in and out of bed, instead of crunching up, roll to your side and push up with your arms. And when you're holding your baby, make sure to hold your baby close to your body and not on your hip, because holding baby on your hip can push your core outward. I'm going to show you a little bit more about the best way to hold your baby and some great exercises you can do. So let's head outside and put on our Lalabu Soothe shirt. A much better way to hold your baby is with a Lalabu Soothe shirt. I love how it distributes the baby's weight through your middle, and you don't have any asymmetry by holding the baby on your hip, which can put stress on your core. I
especially love the Lalabu carrier because it's so simple. You just tuck the baby into the pouch and you're ready to go. You don't have to worry about dealing with complicated straps and wraps. It's just one step and you're ready to go. I just love baby wearing, and I wore my son all the time when he was little. Not only is it good for mother-baby bonding, but it's also really soothing for the baby. Now I'm going to demonstrate a couple simple moves you can do to strengthen your core while wearing your Lalabu Soothe shirt. Now I'm going to demonstrate the squat to wall. This is a great move. It strengthens your legs, but you can also work your core by contracting your core as you stand up. This next move is sidestepping. You can do it with or without a band at your ankles. So you just bend down and take a step to the side, keeping a good contraction in your core.
We have had so much fun talking about abdominal and postpartum health with you. We are passionate about encouraging moms to be strong and confident after baby. If you have any more questions for us, please follow us on Instagram or even message us, or check out our website. Thanks to Lalabu for having us. We hope to be back soon.